Thank you everyone for joining us today. Just to sort of introduce myself, I'm Tanya, CEO from Shipshape Health and Wellbeing, and we created the platform today to create a space for people to come and ask questions and share their concerns really, and also hear from some of our experts, the GPs and our local imams who have joined us for today's session. We put the event together in partnership with Heeley Development Trust, and Maxine is just going to introduce herself.
Hello, I'm Maxine. So I work for Heeley Development Trust. I'm one of the 3 link workers that work for the Heeley Primary Care Network. And as Tanya said, we put this together, but partially because ringing round people, we discovered a number of people who had questions about the vaccine. So we thought it was a useful space to have the discussion.
We've got a few speakers that are that will be sort of sharing and doing. We'll be sort of speaking for about 5 minutes each. We're going to hold the questions, and if anyone's got any questions to the end, just to see how that filters through, just to make sure we can get enough information out as much as we can. And if people have got questions as the speakers are talking, you're more than welcome to sort of put the questions in the chat. And we've got Tom, Maxine and Iran who'll be keeping an eye on them. We will be sort of recording the session, and we will be sort of sharing it on our social media platforms. We have been asked by some of the newspapers and social media platforms locally to see whether we can share the links with them to share onto their social media platforms. If anyone's got a problem with that and didn't want to be involved in that, please feel free to sort of turn off your screen, or just let us know, and we'll make sure we can sort of crop you off somehow. And I guess without sort of delaying it further, I'm going to probably ask Ollie to sort of come on first and say a few words around vaccine and a bit about what you guys have been doing.
Thank you, Tanya. That's great. And I won't talk for too long. I'll talk a little bit about the organisation. I think Gasan's going to talk a little bit about the vaccine itself. So I'm thank you very much for inviting myself and Gasan. I'm Dr. Ollie Hart. I'm one of the GPs at the SLOAN Medical Centre, one of the partners there, and I'm the clinical director for our Heeley Plus Primary Care Network, which covers the region around Sharrow and Mearsbrook and the Gleadus Valley and out a little bit, one of the practices out to Totley. And the idea is we've been working together for 18 months to take on situations where it's much better to work as GP practices together, and the vaccine delivery is an ideal example of that. And you know, we've collaborated together, and we've formed a really strong partnership with the community in doing this. So yourselves at Shipshape, at Heeley Trust, we really value that kind of reach into the communities and doing this together. And very much on the site, at the Matthews site, where we've been delivering it as a team, the combination of the clinical teams doing the injections and volunteers and the voluntary sector supporting the site has been really, really powerful. So really appreciate that. We've done really well, really well. We have vaccinated over 7,000 people, including nearly all of the staff from the care homes. Pretty much everybody from the practice teams, everybody's taken up the vaccine, all the staff, because we know it's safe and it's the best way of protecting us against this awful virus and getting ourselves back to normal. So all of our teams have had their first dose. We recognise we're now across our patch getting down to the last sort of 15 to 10% of people who have been harder to engage, and that's been universal across a diverse range of ethnic groups. There's no one group that really stands out, but we really need your help and the reach you have into the communities that you influence to get those last people to come forward. And as we move forward and start to come down the list of the cohorts we work with, to have your help in doing that. So the last thing, I will just tell you a little bit about those cohorts. So the government's been really clear that actually the most vulnerable people have the biggest gain from being vaccinated. So, and what makes you vulnerable is a mixture of things, your age and your health conditions. So they just define these 9 priority groups, starting at the top with people who are in care homes and the staff in care homes, then people over the age of 80 and frontline health and social care workers, then people over 75, and then people over 70. That's the top 4 groups. And the target for the country was to try and vaccinate as many people in those top 4 groups by February the 15th, so by next Monday. And we've, like I say, we've been doing really well locally with that. From the 15th of February onwards, we'll start to work down those groups, so down into people over 65, people over 60, but then also all the people with long-term conditions like diabetes, COPD, sort of heart disease, strokes, whatever age you are. If you have a long-term condition, you'll fall into that cohort 6. Then people over 55, and then finally people over 50. We're not sure of the plan in people under 50, but what we know is that people under 50 have a much less chance of having a serious condition. 99% of the deaths from COVID have happened in people over the age of 50. So we're clear that's where we should be focusing. So really grateful. I'll shut up now, I think, and let Gasan tell a little bit about the vaccine itself. And then I think answering your questions is probably a really powerful way to go. So over to you, Gasan, if that's okay.
You're on mute, Gasan.
Thank you, Ollie, for that good overview, and you basically covered most of these. I just want to again echo what Ollie said, and thank you all for joining this platform. Fantastic platform. The government has just now realized that we need to start to work harder towards the BAME population. We've already realized this weeks ago and been working on this. So we are a step ahead, and we've done very well in vaccinating 7,000 patients, but that number in itself means nothing if we don't catch the correct cohort of people. There are 3 vaccines which have been licensed for use in the UK. There's quite a few across the world which are in the process or going through the final trials, but the 3 vaccines that are licensed for use in the UK are the Pfizer, which was the first one to be licensed, and that is it's a collaboration of an American company, Pfizer, and the lab is BioNTech. So Pfizer, and then Belgium is the manufacturer of the vaccine. The AstraZeneca Oxford is a British. The vaccine itself was developed by the Oxford University, and AstraZeneca is the company, the vaccine company. That's a British enterprise, British exercise. Moderna is American. There are different ways that these things are manufactured. They've got some novel techniques well beyond even my comprehension. But in principle, these vaccines, like we know with vaccines we've had over the many, many years since we were born, we've had vaccines against smallpox and measles and so forth. All it does is when it's injected into the body, it stimulates the immune system to produce antibodies. Those antibodies that are produced are there to protect us if perchance we had to come into contact with such an infection in the future. So that's the basic principle. That's what the vaccine is. All they need to do is, it's a very tiny dilute amount of a fragment of the vaccine. So with Pfizer, it's a protein fragment. That's enough to stimulate the body to generate a response. With the AstraZeneca, it's called a vector, which is a harmless virus that is used to carry the genetic material into the body. There are no animal products in this. It has been, and the thing to reassure people is that it's been trialed, and there was no shortcuts. The platforms are already there, ready to use for manufacturing or investigating or producing vaccines. They were there well before COVID started. This was an international exercise. There was vision that with previous outbreaks of SARS in China, in Africa, the Ebola, they realized that these are nasty viruses, and therefore there must be a platform to manufacture a vaccine at very short notice. So therefore the platform was there, and hence we could speedline it. We could go fast with it. It passed all the ethics committee reviews. So it was ethically, there was no shortcuts there. It was ethically checked. It was peer reviewed, meaning that independent fellow virologists and researchers, etc., looked at the research and reviewed it and considered it appropriate. And it was given the license by the MHRA, which is our regulatory agency. Our regulatory agency is MHRA. considered to be the best regulatory agency in the world. If it's good to use, it'll get passed. If there's any doubt, it's not going to get the license. And then the Joint Committee of Vaccination and Immunizations then sat down and looked at the various groups, which Ollie mentioned, the cohorts, the most vulnerable to the ones who are least vulnerable. And the aim of our exercise up to this point is to catch the most vulnerable people. Now, alongside that, there's been enough evidence internationally to show that people of the ethnic minority groupings, what we call the BAME grouping, tend to suffer more complications, tend to have higher what we call morbidity, complications, higher mortality, higher hospital admissions. And hence, with us, in line with vaccinating, more energy is being placed into these groups of people because there seems to be, I would say, reluctance and maybe skepticism rather than an anti-vax attitude, skepticism around it. And the aim of this is to try and win hearts over by giving the facts, answering the questions, so that when we go out there, it's answering the questions that people would ask. I'm done.
Thank you, Gasan. That's great. Thank you, Ollie and Gasan. Next, I have Imam Osama.
Hello. Thank you, everybody, for giving me this opportunity. And my name is Imam Osama. I'm the Minister of Religion from the Makki Mosque in Sheffield. And my main role, especially during this tough period, during the pandemic, has been educating the young, the old, and especially in the recent month or two, speaking about the vaccine and also clearing the misconceptions amongst the public in regards to the vaccine. And even today, in the next few minutes, which I have, what I would like to speak about is more of an Islamic perspective on the vaccine and what we find from the books, from the Quran and from the Hadith, what we find in the old manuscripts regarding what we should do in this type of a situation, because pandemics and plagues have been there from the time of the Prophet Muhammad, peace be upon him. And also the Prophet Muhammad says that whoever practices medicine without having studied it shall be responsible for any harm he causes. And I've actually quoted this hadith many times in my lectures, and we've also liaised with with different media platforms, with the BBC, with the ITV, recent interview. And I've mentioned that this hadith lays out a very important principle, that if a person gets involved in a field that he is not qualified for and ends up causing harm to others, he shall be responsible in the eyes of Allah, God, and possibly in the court of men as well. So therefore, if someone has no knowledge of medicine, having never studied it or practiced it, but shall take on performing surgeries, both legally and morally. So for any and all damages his practice incurred. On the flip side, we can also derive from this hadith, from this saying of the Prophet Muhammad, that if a qualified doctor makes a sincere judgment call, which turns out to be a mistake, generally speaking, he shall not be liable. And because we currently have a global pandemic raging, devastating lives and disrupting every aspect of society, now that there is the potential for a vaccine, and which we have a vaccine at this moment in time, 2 vaccines, we should let the specialists speak about its pros and cons and don't jump on any populist bandwagon. And realize that if we forward, and especially because you've probably seen on social media, we have the anti-vaxxers making videos outside the vaccine places, outside the test centers, and spreading nonsense. And it's very unfortunate that sometimes people have labeled this that this is probably the view of the religion. And we also have some famous clerics also speaking on this, and which they have in reality no value in society, and what they speak, this goes against the mainstream and orthodox religious beliefs. So rather than forwarding these nonsensical videos or rely on incorrect information that potentially causes someone else to do something that is harmful, for example, to not take a vaccine that is effective, you might be liable for any harm caused. So also we need to note that not everyone who can quote a verse or two is a scholar of Islam, and not everyone who wears a white jacket and a stethoscope is a doctor. So we need to do our research and look at the credentials and specialization and reputation of the one who we take any knowledge from. And that is why I really thank here the Heeley Trust and the organizers of this meeting and this Q&A session, that for raising awareness that we are doing everything we can in our congregation and taking this on a social and on a regional level. We do thank you, and we really hope that people take this seriously. And as scholars, as Islamic scholars, we are always here and working very closely with the doctors, with the media, and trying to promote positivity. So this is all I would like to say, and thank you very much for giving us the opportunity. Thank you very much.
Osama, that was great. Just before we move on to the next speaker, is there any questions for Ollie before we lose him? Because he's got to go in probably about 5 minutes, I think. Is there any questions that anyone would like to ask Ollie?
Saima.
Hi, Ollie. Hi, everyone. Ollie, just have a question. One of my client I'm working with at the moment, and she asked me this question. She said she's only 44-year-old, and she came from India, and her mother is critically ill since last year, and she have a cancer and things. And she was planning to go to see her for the last year, and because of the pandemic and coronavirus and restrictions, she have to postpone her travel for 4 or 5 times now. But now the situation is it's kind of the end stage. She never seen her for the last 10 years. She really wanted to see her, but she can't really afford to have the vaccine and lots of other expenses going to there. And she was saying to me, could you please ask behalf of me, is there any concession or any kind of criteria where these kind of people who have to do emergency travel can be given the vaccine, so she feels a bit more protected and things?
Yeah, thanks, Simon. It's a really good question, and clearly as doctors and fellow humans, we're always wanting to help, and we're always wanting to support people. But there is a but here. We also have to be really fair. There's lots of people making cases for having the vaccine early. We may well get down to people who are lower age or have less clinical problems themselves, but not yet. And we just do have to really stick closely to the government guidance, which is there for a reason, really. The trouble is, every time we give a vaccine to somebody who isn't in the high-risk group, it means we're not giving one to somebody who is, and we're depriving them of the benefit of that. People are making cases for teachers and workers in shops and police and so on, and we're just having to be really strict and consistent and fair with everybody, that we're prioritizing people in the order the government's given us. So I'm really sorry. Although we'd love to help, we're not able to, to make exceptions. Really, we have to be fair across the board to everybody.
Right. Thank you very much. Yeah. Thanks.
Phyllis.
Yes, I don't want to take up too much time. I just wanted to say to Ollie, though, and the other staff, how well organised I think it's been. With the practices getting together and the rollout of the vaccine. I am over 70 and I've had my first vaccine, thank goodness. And all, the volunteers were all great and everything. So I think it's, I commend you on how well organised it's all been. I've just got one thing to say though. I think people might have been getting different information about how covered they were straight away after the first vaccine. I think everybody that comes for a vaccine needs to be told really clearly that they're not covered straight away, and there's, you know, it could be 3 weeks before they've got any immunity, and that they're not fully covered until the second vaccine. That's my understanding. But I think people haven't been very clear when they've had their first vaccine, how, you know, whether they are covered straight away or not. So that's one thing. The second thing, I just wanted to quickly ask if you knew when the second vaccine for older people was going to be rolled out in our area.
Yeah, I'll answer that. Thank you, Kathy. The second vaccine rollout is up to 12 weeks following the first dose, and it's going to be whatever they received the first time, they'll get it the second time. So if they receive the Pfizer, they would be expected to get the Pfizer the second time, and by the same token, the AstraZeneca. Evidence, we don't make that decision. I've just seen some information coming through that some heads up, some preparation we need to consider now that the government will soon start announcing the rollout for the second dose of the vaccines, and we need to start around coming up to the 12-week period of the first dose. So at the moment, we know as much as you do, and we're only guided by the guidance that comes out. And once we get that guidance, then we will start moving ahead into giving the second doses alongside the usual vaccination. The amount of work we do, the amount of effort we put in is entirely dependent on the supplies we get. If we get, however, 1,200 or 2,000 doses of vaccine, we would manage a clinic to take that, to manage a clinic appropriately for that and go down that route. We have to follow the guidance because there is a lot of scrutiny on that. With respect to immune status, you were quite right, up to 3 weeks, usually after the second week, but the vaccines do not show evidence that it protects the person vaccinated from transmitting the virus. So whilst they may not likely get COVID disease, for example, they could still carry the virus and pass it on to someone. They could be asymptomatic, so therefore still wearing the mask and so forth. We should not drop our guard by nature of having the vaccine. It's a reassurance in that, in some ways, having the vaccine, but it's not 100% foolproof. More studies are coming out. For example, the Pfizer has shown that it may be effective against some of the variants, whereas the AstraZeneca has shown to reduce transmission to other people. Overall, the message is, yes, there is immunity, but you still got to follow the guidance out there with respect to isolation, washing hands regularly. If you're touching surfaces, keep your hands clean, and also wearing the mask as much as you can. There's absolutely no change in that guidance. I hope that answers the question.
Thanks, Gasan. And I'll just add a couple of points to that, Phyllis. And so timing-wise, our centre started on January the 5th. So 12 weeks on won't be until the start of April. So nobody, not even the clinical staff in the health centres, will get their second vaccine until 12 weeks on. That's the kind of the national policy, and we really support that. What Gasan says about protection is really, really important. And what was my thing I was going to say? Oh yeah, I think the other thing is that there's all these studies out there, but what we recognise is that the two vaccines we've got, Pfizer and AstraZeneca, are really very similar. They do take a little bit of time to build up, but we think their protection is very, very similar. So there's no difference between the vaccines really. They're both really good.
Yeah, and at the moment, if I just want to chip in just on what Ollie said, there's no choice. Patients can't say, I want this over that. Both the vaccines we give it equal status, and we will offer that whatever vaccine is available to the patient on that time. There's no guidance and nothing instructing us to change the vaccine from one to the other, or for patients to choose or wait until they get the AstraZeneca rather than the Pfizer. Nothing of that sort. We may make a clinical decision to give one vaccine over the other, but that's a very rare situation. But that's a clinical decision based on an individual patient. But overall, patients don't have choice. it's not a bad thing because these vaccines are both very, very effective. We get injecting them, more and more studies are coming out, and it's looking good.
Folks, I'm really sorry. I've got to jump off to host another meeting, but I really appreciate all your efforts and support with us. Thank you, Imam, Osama. That was really helpful what you said, and I know Gasan will be brilliant at answering more questions. So good luck and thanks for your ongoing support.
Thank
Cheers.
you, Ollie. Thank you.
Thank you very much, Ollie, for your good.
Cheers.
Thank you.
Was there any more questions? Oh,
Maureen's got a hand up.
yes, I can see that. Noreen?
Yeah, hi everybody. I'm sorry I haven't got my video on. Working from home, just think of it as a bad scarf day or something. But I had a question for, yeah, I'm so sorry about that. I've been working, well, I've had the Pfizer, the first injection. Now I know that they said 12 weeks, and I know if somebody else can answer on that one, I think after 12 weeks, doesn't it wear out? Because I'm hearing other countries that have the injection after 2 weeks.
First of all, I just, before I answer the question, Noreen, I just must apologize. I should have introduced myself. So you probably know I'm a GP.
Right.
And I'm a GP lead at Matthew's practice, and we're part of the same network called Heeley Plus. And our practice is used as a hub. So that's my introductions now.
Thanks.
The vaccine, it doesn't wear out after 12 weeks. In fact, evidence is coming through that even beyond 12 weeks, it's actually good efficacy.
Great.
The science behind delaying the second dose is fairly simple. The second dose is there to give immunity. It's there to boost whatever you've got. We do that often when we're giving the MMR. Bear in mind, the MMR dosing, initially you give it to 3 months and you give it a year later to boost immunity. It happens with hepatitis B. It happens with quite a few other vaccines, the meningitis vaccines and so forth that we're giving. We give booster doses quite far apart. And the aim is that the longer we know that up to 12 weeks, there's over 70% immunity, and studies are showing that even beyond that, immunity is pretty good. So the longer you wait, the advantage of giving the second dose at that time is that the peak from the second dose will be much better and much higher than if you did it earlier, whilst we're still building up immunity from the first dose. If you're building up immunity from the first dose that's earlier and you give the second dose, the peak is not as high as building up immunity from the first dose to that point and the peak going higher.
Yes, thanks for that clarification. Now, okay, I'll keep it very short. The thing is, with my first lot that I had, I felt quite unwell. And I think I felt more unwell because of the messages that I was getting from friends and family that I shouldn't take the injection, and the conspiracy theories that just raised my anxiety levels and just triggered my vertigo. So it was a whole lot of combination of things. So when I went back to my GP, we just ruled out all the other things. But now I hear that with the second vaccination, which I'll get more poorly than I was with the first one. Is that something, or is it just individuals?
First of all, if you react to the vaccine, you become a bit unwell, you have a mild flu-like illness, that's actually a good thing. It means your body reacts better and will pour out more antibodies than someone who didn't have symptoms. So that's actually a positive thing, whilst it may not make sense, but actually it's a good thing. Yes, you may react to the second one also, but not necessarily as bad as you did the first time, because you've already got antibodies. So, and again, caution, as Imam Osama said, caution from taking or listening to people who are not qualified to say certain things about the vaccine, because that is where the bigger problem is. It's not the vaccine. Sometimes it's not the illness of COVID. It's the hysteria, anxiety, and the misinformation, which could be far more detrimental. One person with an idea could spread that so far ahead, well beyond what we could comprehend. So that in itself can be detrimental.
Thank you. Thank you for that.
We've got a question from Denise. Once we've done that question, we'll continue with the introductions, if that's okay, and then everyone will have more opportunity to ask questions towards the end. So you want to go ahead, Denise?
Yeah, can I just ask, if you're asymptomatic when you have the vaccine, is it still effective?
Yes, of course.
Yeah.
Yeah.
Right. Okay. And just one more quick question. If you've got the virus, is there amount of time after your isolation before you can have the vaccine or not?
If you've had COVID, you can be offered the vaccine and take the vaccine a month after
1 month.
a month after the first onset of symptoms, so 28 days.
Okay, thank you. Thank you.
Thank you, Gasan. Just going to move on to our next speaker. Oh, yes, he's joined us, which is Imam Sadaqat Hussain from Madina Masjid. Imam Sab, you're on mute.
Hi.
Yeah.
Hello there, everyone.
Hello.
Yeah, Bismillah ar-Rahman ar-Rahim. So, first of all, thank you very so much for allowing me to come onto this platform and say a few words in regards to the COVID-19 vaccine. Basically, my message is very clear. We all know that the BAME communities have been disproportionately affected due to the COVID-19 pandemic. And at the same time, as the vaccine has been rolled out, we've seen some degree of hesitancy from the BAME community and the Asian communities in particular in taking the vaccine. And I actually believe that this hesitancy, this anxiety has been driven due to two main factors. Firstly, the natural question coming to people's minds from within the Muslim community, whether the vaccine is permissible or not. So whether it's okay to actually take the vaccine, meaning it's halal to take the vaccine. Now, we can say with all confidence that the scholars and obviously the experts, they've obviously researched into this, they've looked into the ingredients, and we can say that the vaccine itself is 100% halal, is permissible for one to have, and there's no kind of animal product, no fetal cells, or no type of gelatin within the ingredients of the vaccine. So that's the first thing. And I think the Imams have actually played a huge role in trying to get this message out and raise awareness. We've seen not just in Madina Masjid, but in mosques throughout the country, raising awareness, talking about the importance of taking the vaccine, and trying to obviously put confidence into people's minds that the vaccine itself is permissible. There's nothing haram or impermissible about it. And to take it one step further, we've actually had many scholars and Imams from within the UK who've actually taken videos and pictures in them having the vaccine, taken upon having the vaccine. So that's actually helped in many ways for other people to actually be confident in taking the vaccine itself. One of the leading Muslim scholars in the world, Sheikh Abdullah bin Baya, he actually had a video taken of himself whilst he was having the vaccine. So this has helped in many ways for the wider community to come forward and have the vaccine. And the second thing, which has raised a lot of doubt and caused hesitancy within the Muslim community, is these myths and these rumors and these conspiracy theories that if they have the vaccine, then it will genetically modify their bodies and it will have an effect on their way of life, and so on and so forth. And this kind of misinformation, which has led to people having second thoughts, or rather actually completely moving away from taking the vaccine. So I think this is another thing which obviously needs to be reassured from everyone. And I think this can only be done when we work together. I mean, like I said earlier, obviously within the mosques, we've been trying our best and utmost to try and get this message out to our congregations, about on the importance of taking the vaccine and dispelling the myths and the rumours surrounding it. That if they do have it, then what happens to them? I mean, and we've been and the best way of actually doing that is doing it themselves. I mean, I haven't have my vaccine yet. Obviously, I haven't reached that. But when the time comes, then most definitely, we'll try and get out there. Take videos, pictures, so we can obviously share it with our obviously congregation and the wider community, and make it easier for them and make them feel comfortable in taking the vaccine itself.
Thank you, Imam, Sadaqat. Just sort of touching on that, I think the importance of the impact the messages the mosques have put out, I guess locally and across the city has made a huge difference. We do a lot of engagement with communities who are really vulnerable, and particularly those from the BAME communities who had sort of made up their mind that they're not having the vaccine done because it's not halal, they don't think it's safe, and there was a lot of misinformation being shared. But we've seen a huge sort of shift in people's minds since sort of just before Christmas and up to now, where those videos have been shared, and it's been nice to be able to sort of share those videos to say, well, actually, your local imams are backing this, and it has changed a lot of people's mindsets to start to go out and actually get the right information and to be making a lot of those right choices to go and sort of get their vaccine done. So I think that's huge thank you to our local mosque, our mosques in Sheffield that have actually really stepped forward to implement a lot of those videos. Is there any questions? No? Move on to our next speaker. I just want to see my screens. Everyone keeps moving on my screens, and I just want to see if Imam Aslam Zahid has been able to join us. No?
I think he's on, but I'm not sure if his audio or video is on.
He's just unmuted himself.
Yeah, I think he's on, but I think he's trying to come on.
I think Imam Aslam Zahid is not available, but Zahid is available.
Hi, Zahid. I'm just gonna we might just move on to our next speaker, who is Cinnamon, and then come back to Imam Aslam Zahid, if that's okay. Noor, could you just see if he needs a bit of help in just to see if his mic's on? If you want just thank you. So our next speaker is Cinnamon, who's a health advisor for Sheffield City Council, but she's also a registered nurse.
Hi, I mean, this is wonderful. Thank you so much for inviting me. I feel like I am, a bit underqualified, to be honest. And I just wanted to echo some of the points that Gasan and Ollie made. Really, I'm spending a lot of time talking to people, cases, contacts, people in complex settings like care homes, staff, and there's a lot of people who are having this, and it's really understandable. It's been nearly a year, sort of this, oh, well, we've got a vaccine, we don't need to worry anymore. Oh, it's a bit sort of over, and we all want to feel like that. And it's, we're all a bit optimistic sometimes, which is lovely that we view the vaccine really positively. But actually what we were saying, the sort of hands, face, space, still following, washing your hands, all of these things are still really important. If you have symptoms, even if you've had the vaccine and you've had symptoms, there is still a chance. Unfortunately, you still need to get tested. If you're contacted as a contact, you still need to isolate and all of these things, and that sort of slight complacency sort of creeping in some places, just because. And I think that's sort of people being optimistic, and also that sort of COVID fatigue coming in a little bit, unfortunately, which is really natural. We're all doing it a little bit, aren't we? We're just sort of sick of it all, and everyone is that just, but that, get your vaccination, but you also unfortunately need to do everything else. And if your loved ones have had the vaccination, that doesn't mean that you can go, oh, well, my vulnerable granny's had the vaccination. Oh, well, my daughter's coughing, I'll still take them round because they've had a vaccination. And all of those sort of things, unfortunately. Yes, they're safer, but still be aware, because there is, you know, still all those risks, unfortunately. But, you know, it's some really important messages here today, and you know, it's really fantastic and an absolutely fantastic event that you guys have put on, really.
Thank you, Cinema. Do we have any more questions? Tom, Maxine, did we have people sharing questions that we probably want to ask?
Have we finished with all the introductions?
I'm just waiting for Imam Aslam Zahid to join us.
Okay. In the meantime, I've got if no one's got on the call's got a question, I've got a couple from community members. This is probably best for you, Gasan. It feels quite specific, but someone has asked about they've had a kidney transplant and take something called tacrolimus, and they wanted to know whether it's safe for them to have the vaccine. I guess that generally might apply as a question for a lot of people in the community who are maybe on different types of medication and are maybe worried how that might interfere with them.
That person falls under the extremely vulnerable group.
Sorry, Gasan, you've frozen there.
Oh, I think we've lost him. Okay.
I think he's just frozen, isn't he?
Yes, he is.
But I suspect he can still hear.
I'm sure he'll join us once he's logged back on. Oh, here we go. You're back, Gasan.
Oh, great.
You're muted though.
I'm fine now. For some reason the internet just disconnected, so I've just reconnected. Right. That person you're talking about should definitely have the vaccine. They are in the extremely vulnerable category, which is in cohort 4. I'm a bit puzzled. I'm guessing they haven't had the vaccine, and I'm just wondering why, if I dare ask, because if they're asking questions as to where it's safe to, they should have raised this question a while ago with their consultant, at least, a specialist or GP.
Okay, I'll make sure that's passed on. I'm not. It's a question that's being passed on, but I'll make sure that person.
Yeah, definitely. The point to be made is that if someone's on any medication like tacrolimus, which is an immune suppressant, they are considered extremely vulnerable because their immune system is not as robust as someone who's not, for example. However, they should still take the vaccine because they can still produce antibodies, which will protect them to a point. And at the worst case scenario, if they have to catch COVID, they probably won't end up in hospital in ICU or even succumbing to it. They may get a flu-like illness at the worst and survive it pretty well.
Great, thanks, Gasan.
Yeah.
Maxine, did you have a question about vaccine sessions in mosques?
Yeah, I wondered whether or not, I mean, I think Gasan's been trying to sort out some sessions, but I wondered whether or not people thought it would be a useful thing to do some sessions in mosques or in community sessions, because I've been ringing around to ask people to come and have the vaccine. I have found a number of people, they're not COVID deniers. They're just people who are worried. And actually it's interesting that the other question came up about people who are having, who've got real problems, physical problems. A lot of people are saying they've got a lot of problems at the moment and therefore they don't think they should have the vaccine. And they're precisely the people who've got lots of medical problems who should be having the vaccine. But it is quite interesting that that's how a number of people think. And then there's a number of people who are saying that they're shielding and therefore they're not going to catch the virus and therefore they don't really need to have the vaccine. So, I mean, I don't know how you would answer that, Gasan, but I think that's a useful thing. And I wondered what the imams thought about trying to do the vaccine inside the mosques.
Yeah, if you look at the similar analogy, when people say, I don't want to wear a mask because I have breathing problems, don't realize not wearing a mask actually exposes them more to the risk of catching the vaccine, and which is worse, wearing a mask, which there's no evidence that it causes breathing problems, or walking around without a mask and facing that risk of catching COVID, where almost certainly that person who's got medical conditions could become quite ill. As far as the venue of the mosques, it was something I'm like an open book on this, and I would invite the opinion from the imams and know as to what their thoughts are or what suggestions they have. It makes sense to look at a different venue which is supported by the imams, and from our point of view to set up a vaccine hub as a one-off to invite those group of people who we're trying to reach to. There's no problems with that. The vaccine is easily transportable. We've got all the equipment, staff, etc., and can easily be done.
Does Imam Sadaqat and Imam Osama want to come in on that?
Yes, certainly. I think obviously what's been raised in regards to bringing in the mosques, because like we said, the mosques and the places of worship, they play a pivotal role in raising awareness within our communities and the wider community as well. But we've already seen many mosques throughout the country who've used their places of worship as vaccination centres, vaccination hubs, where people have come in and had their vaccine. They had their vaccine in the mosques. We've already, I think there's a mosque in the Firth Park area, which already have actually used their mosque as a vaccination centre. So I think it's a brilliant idea. I mean, if the mosques also come on board, which we already have, I mean, but if more mosques can come on board as well, in helping those people who are probably a bit anxious and still have that kind of hesitancy within them in taking the vaccine. If the mosques can obviously come on and allow the mosques, their premises, to be used as a vaccination centre, it will bring a lot of confidence in people to have their vaccine. But as we said, it's just something that we can only do together. I mean, like they say, there's always light at the end of the tunnel, and this is something that we all need to come together and try to defeat this COVID virus.
And thank you very much, Imam Sadaqat. I second, whatever he said is what I was going to say. And would love to invite Dr. Gasan to the mosque. Would love to host him, and because we have quite a big social, all our services, the talks and the lectures, and also the lessons for the children, they're all taking place on Zoom and on the YouTube platform. So we'd love to invite Imam Gasan if he could give us some of his valuable time and hopefully speak on the vaccine, and love to host him.
That's absolutely fine, Imam Osama. Maxine can arrange whatever. I'm pretty open to whatever needs to be done, and Maxine could be a point of contact, or Matthew, if you want. And if you want to communicate directly with me, they can pass on my email address or even my mobile number. You can have a chat. I wasn't actually say. It's just coincidental. I was actually to invite the imams to my practice and to come and see what it's like. We follow all the guidance as you would expect with respect to being COVID aware, and we're safe enough, and we can make sure it is safe enough and for your peace of mind. But it may be also, useful if you wish to come and see what services we have and how the service is run. You don't have to come when the vaccine is when it's happening, because there's quite a lot of crowd then. Probably going to be more risky. When it's quiet on a normal working day, we can show you the whole place through, and whatever you see in that practice will be a very similar model to what we would look at doing in a hub.
I think definitely that sounds very interesting. And I did have mentioned a few times that if any arrangements could be made for the imams, especially for taking the vaccines, because we are still carrying on our services as, you know, congregation, just come to the mosque, and we are having obviously prayers with the social distance. So it'll be something good. And thank you very much, Maxine, for the email. And I think straight away we will compose an email and see what we can do.
Sure.
Thank you very much.
That's great. Thank you, guys. There's a couple of hands raised. We'll go to Sheffield Foyer first, and then after that we'll go Noreen Khan and yeah, Sheffield Foyer, if you'd like to go ahead.
Hi there, my name's Sam Mobbs. I'm the manager at the Sheffield Foyer. We are a supported housing project for young people aged 16 to 25. I would say that about 80% of my residents, and there's 60 of them, will not be getting the vaccine. And we want to do a campaign early to try and educate people about the positives of getting the vaccine before their time comes. I presume that'll be sometime summer or autumn. I've just had a young man with me who's now unfortunately left. He said that he wouldn't be getting the vaccine because he's allergic to a lot of the things that are in it, even though he doesn't know what's in it. There's a lot of scaremongering. A lot of our young people only listen to social media, watch Facebook, YouTube, don't necessarily get the facts. We need help in educating ourselves and them on what the best way is to persuade them that this is a good idea. Even though all the staff have had the vaccine, that doesn't seem to be making much difference to them. So I wonder, is there anything out there that's a straightforward, plain English fact sheet about what's in the vaccine, why it's important, and to maybe stop them being so frightened? There's so many different myths out there. I don't think myth busting is necessarily the thing that we need to do, but just giving them the straight facts about why it's important and to them.
You want me to answer that?
Yes, please, Gasan.
Thank you. The 16 to 25s, yes, are further down the queue. Quite right. With respect to the information, there's a whole host of information on NHS and gov.uk. This is not information pitched at the level of a clinician or GP. So it's not medical jargon. It's actually public information to answer as much of the questions. And there's all the information is there about the vaccines, about the categories and the exclusions, those who shouldn't have it, etc. With respect to the issue of allergies, there is a very small proportion of people who may not take it. So even people who got a history of a significant anaphylaxis to a known substance, say, for example, penicillin or some sort of food substance, a known anaphylaxis, can still take the vaccine, and we would offer them the AstraZeneca generally. But even with Pfizer now that they've relaxed the regulations, there's been no history of a true anaphylaxis that we know of. Initially, when they gave the vaccine, the two people that reacted or had a reaction to it did not, eventually was found was not a severe anaphylaxis anyway, or severe allergic reaction. So overall safe. There's no products in that should stop them from having it or contraindicate it. The only potential reason for not having the vaccine is where someone's got a history of multiple significant allergies, which would make it a bit more risky, or someone has got a history of a significant anaphylaxis, that means a life-threatening allergic reaction to an unknown substance. That is the potential. But even then too, we can have a one-to-one talk and give the vaccine and observe them. We've got the full anaphylaxis kit. 7,000 patients that we've done, no anaphylaxis at all. Another myth that I need to dispel is that young women feel that it may cause fertility issues, so they do not want to take the vaccine. There's no evidence to support that at all. Zero evidence. What we do say is that if a woman takes the vaccine, they should not conceive within 2 months of having the vaccine, and thereafter they should be fine. We have to look at the rationale behind a young woman or a woman not wanting the vaccine because of the risk of fertility issues. If they don't take the vaccine when it's their time to have it, and they fall pregnant, they're still at risk of developing COVID, which will pose a more significant risk to them and potentially to the pregnancy itself. So on a balance, it's not rocket science to realize that there's a benefit in having the vaccine, especially if they want to fall pregnant, to protect themselves in the future.
Thanks, Gasan. Sheffield Foyer, feel free to reach out to Shipshape or anybody else who's puts their email in the chat about any, because there have been lots of conversations about how to have those kind of conversations and get those messages across. So we'll pass on as much as we can that we've found helps to have like positive conversations. Noreen Khan, you had your hand up. Would you like to go ahead?
Yes, thank you. This is a question for Gasa, I think. What is the difference between the two vaccinations? Like I've had the Pfizer, but then why is the Pfizer more expensive than the other one?
Good question. Pfizer is an American company. Heaven knows whether they've not mentioned this. Heaven knows whether they is going to be generating a profit. It is It is not an easy vaccine to store and manage. So I don't have an answer to that. It's the vaccine company. What I can say is that AstraZeneca are providing the vaccine to the public at cost, because there has been a significant amount of money given to these companies. I could certainly say for AstraZeneca, I'm sure with Pfizer, giving to the companies to do the studies and generate the vaccine, which meant that they did not suffer any major costs or expenses that they need to recoup. So quite rightly and ethically, I would say, AstraZeneca is producing that, is making available that vaccine at cost, because they are breaking even, basically. I don't have an answer for the Pfizer one, but Pfizer one is just more tricky. It's stored at -70 degrees, and once it's taken out of storage and it's delivered to the practice, we've got a maximum of about 4 days to give the vaccine. And then you've got to mix the vaccine, and you can't transport the vaccine to multiple sites. So once it's on our site, it stays there. Whereas the AstraZeneca storage is easy. It's at fridge temperature. It's got a shelf life of about 5 months. So if you've got a vial that's delivered to us, we've got up to 5 months to use it. It can be transported to multiple sites. It's not unstable when it's been transported. Hence, when I was talking about looking at using a hub, and with imams using a hub, maybe a mosque or a community center, it's easy to pick up a couple of vials of the AstraZeneca vaccine and take it along and do the jabbing. It's very easy.
Thank you.
I noticed that that Cinnamon has offered workshops for the forum, for Sheffield Foyer, if they want them as well, which I think might be quite useful. And I think it's important that we win the hearts and minds of the younger people as well, because quite often they influence what happens in terms of the older people, whether or not the older people will take the vaccine. So sometimes you ring up and you're speaking to younger people, and they're then speaking to the older people to make a decision about whether or not. Can I just say something about the difference between AstraZeneca and the Pfizer one? Because the Pfizer one's much more expensive, isn't it? And because it's a private company, and AstraZeneca obviously is the Oxford vaccine, which has been a not-for-profit organisation that's pulled the second vaccine together, which is why on one level, you know, there's some people who are very unhappy about the money that's being made by these enormous companies. So on one level, the AstraZeneca one does mean that it's been produced by a not-for-profit organisation. So I think that's it's quite useful to know as well. I mean, I'm sure there's not a lot of difference. Can I just ask one question as well? I noticed that in America, one of the companies have developed a one-shot vaccine, so you don't have to, you have it just once a year. And I suspect that are we not moving towards a situation where, like the flu vaccination, we're going to end up having a COVID vaccination at the same time once a year? What do you think, Gasan?
Yeah, I think that's going to happen. I don't think that's any secret, like the flu. When we talk about variants, we hear about the variants, the Kent variant, the South African variant, and so forth. This is what viruses do. The cold virus does that all the time. Hence, we get colds every year. You ask yourself, well, we had a cold last year. Why are we getting cold? It's a variant of the cold virus. These viruses change the pattern of behavior all the time. That's the natural behavior of viruses. And the coronavirus is no different. The coronavirus is a cold virus. COVID-19 is the variant that causes the disease that we talk about, but it's the same virus that causes the common cold and the flus and so forth that we're talking about. So when we say coronavirus, we're using a very broad term because it's a virus that causes multiple different illnesses, but we talk about COVID-19, and that's the specific strain that causes the problems here. Because the virus can so easily infect people, because people are not immune against it, it so easily affects, it has the ability to do as it pleases. When you have got an open forum or something and you've got freedom, you will do as you please, whatever you want to do. And the virus is like that. And in so doing as it pleases, because there's no restriction to how it can infect people, it starts to change its pattern of behavior over time, and these variants come across. There's dozens of variants that have been identified in the UK, but it's only these specific ones that have shown a more higher preponderance, and hence we've isolated those as being troublesome ones. But there are other variants, but they're not as troublesome as the Kent one, for example, or for example, the one in South Africa. They are more infectious.
Thank you, Gasan. Is there any more questions?
Timer.
Sorry, yeah.
Hi, Gasan. Just wanted to ask which other medical conditions were you exempt to have the vaccine, or you should not having the vaccine? You mentioned severe allergic reactions and any other health conditions, which I just wanted to know.
I have to qualify, severe allergic reaction is not an exemption in its own. They're very specific. If there is someone who's got a severe allergic reaction or history of that, they should speak with a GP to get more information. There is only a very, very small proportion. In fact, by and large, even those people, a lot of those people can have the vaccine. I'm being careful what I say, because I don't want the message to go out that if you've got a history of a severe allergic reaction, you can't have the vaccine. There's quite a few people that who've come through us who've got that history but had the vaccine. Okay, right. So it's not an issue at all. It's people who've got a history of an allergy to a vaccine, a proven allergy to a vaccine itself, and that's not common. That's not easy to prove either. It will be very rare. If someone reacts to the vaccine by getting ill or getting a localized redness in the arm, that's not a severe allergy. That's just a reaction to it. That's not a reason. That's not a contraindication or an exemption to have the COVID vaccine. at all.
So if you're worrying or anything, you can contact your GP, and GP knows exactly what to guide to this person.
Yeah.
You know, you don't need to make assumptions like, oh, I can't have the vaccine because I have a kidney problem, I have liver problem, but you can contact the GP and they can guide you better.
Yeah, I would also say before that is to look up online on the guidance. If they're pretty IT savvy and they're good with the computer, is to go on to gov.uk and look it up. There's so much information there. It answers every possible question. And once they're armed with that information, if they've got questions, then they can raise that with the clinician. Yeah.
Thank you.
Can I just ask, Gasan, what are the uptake like within your PCN from within the BAME communities coming forward to take the vaccine?
Well, we managed to break it down, and we've seen with practices, the general uptake overall is pretty good. I mean, we've had quite a lot of people of the, the BAME population, the Black, Asian, and minority ethnic groups of people coming in, which is very reassuring, because I know they take the vaccine, they will take that message back, a positive message. Some practices which have got a very high proportion of BAME patients seem to have a lower percentage of uptake. We've got the stats, and that's the reason why we want to do this, to try and we're more than happy to look at a situation where whilst we're vaccinating, we're also concentrating on these other vulnerable groups alongside while we're doing our work. So for example, if we have to go to a local hub, a community center or a mosque to vaccinate people who would rather come in as a drop-in, but this is only aimed at people who are patients of our network. It's not an open door drop-in policy. I have to be very careful. It's only to those who are patients of the Heeley Plus network. So the patients of any one of the 8 practices or 9 practices, and they want to do that, then it's something we can contemplate and do. Yeah.
And is there sort of possibilities of PCNs working together to make that happen? Because there's obviously the Heeley PCN, but there's also the City PCN, which kind of sort of slightly overlap into the Sharrow area, I guess. And is there opportunities if their figures and uptake was low within those patients, matching what your PCN has? Is there any chance where there could be a collaboration of how that might be joined up?
Yeah, the message is getting out enough to start to improve collaboration, because sometimes we work together to try and catch the bigger group of people. But we are mindful because it's all got to do with vaccine supplies. Whose vaccines do you use? It's like everyone's got their own. So there's 13 PCNs and everyone gets their own supplies. And then they have to look at how they're going to disperse those supplies with respect to vaccinating their patients. So it is something probably Ollie would be able to answer, because he has meetings with fellow clinical directors of the PCN. But you're looking at, for example, in principle, if 2 PCNs agreed to do this, and then we look at a combined clinic, in principle, it's absolutely fine. It increases the uptake. And then we have to look at how we're going to get the vaccines to manage that whilst doing our usual work. We do not want to be seen to be pulling away to move one whilst slowing down the vaccination process. But what we can fight for, and we're constantly trying to urge the powers above, is that we can ask for more supplies if we got the evidence to prove it. So we say, for example, we managed to improve our uptake with the BAME and we're having a drop-in clinic where we're going to get, say, 50 or 60 people on a morning or even more. And that is a very positive thing. So, we get support then to say, okay, fine, we'll step up the supplies. And if you're doing it as a collaborative effort with with another PCN, that strengthens the forces, it strengthens that request and supply. Yeah. So we can agree to do things, but we cannot go any more forward unless we have the supply coming through. Yeah.
Thanks, Gasan. We've got a question from Jim. Jim, do you want to unmute yourself and go ahead?
Yeah, thanks, Tom. I just wanted to pick up in terms of what the 2 imams have been saying, and firstly, just to Jim saying as one of the local councils, really kind of thank you both for the very prominent position you've been taking in terms of the vaccination. I think that's great, and it'd be really good if the mosques could be used more. I'm really appreciative for that. The particular question, I suppose, a challenge really, particularly to you, but I think to all of us, is some of the messages that you're giving out to people who attend the mosque, whether in person or virtually. I think it's really important, but I'm particularly thinking about those kind of younger members of the community who, to be bluntly, may not be attending the mosque or not engaging from Asian communities, and how you get the message over to them. And I think that's a real challenge in terms of, and that's maybe something we need to be looking at ahead of when they'd be maybe becoming eligible for vaccination later in the year. Thanks.
Thanks, Jim. I don't know if any of the imams want to come in on that.
I think they've had to leave slightly early.
I wanted to add that, what I found most interesting on this call, what I've learned is that I didn't realise that there'd be such a high percentage of young people who were sceptical about the vaccine. I sort of thought that the younger people were sort of a done deal with wanting to take up the vaccine. So I've been quite surprised by that. And I think while we've got so many people on the call, like, are there any other insights into people within your own communities that you've been surprised about how many people are anxious about taking the vaccine, and any insights on things that have worked, success stories in terms of encouraging people and getting people a little bit more on side with it? So someone in the chat has said about their daughter talking about becoming sterile. Gasan, you spoke about that a little bit earlier. But yeah, if anybody has any more insights on stuff that they've found, like, I think that's it's really beneficial for people to hear that, and so we can work out how to address those kinds of issues.
Just to sort of add on, I think just touching on what Jim sort of put out earlier around the messaging stuff, that there is a lot of stuff happening across the neighbourhood by sort of groups and providers who are really looking at doing some focus engagement stuff and getting the message out there as early as we can, and there sort of NHS and Sheffield City Council are sort of involved and really sort of tying in close to how we actually reach that message out and how we get people, particularly as we move down the cohorts of particularly young people taking up the vaccines. One of the things we've picked up for a lot of our engagement is we get a lot of young people who are carers of within the household of one or number of people that they care for, who are making the decision of whether the elders in their family have the vaccine or not, and it was quite worrying because most of that come back to us was that they've decided that no, they don't need the vaccine, they're actually fine, they're not going to put them through any more pain, and they'll wait until June or a couple of months until everyone else has had it to see if they're going to make the sort of get the vaccine done, and that was one of the challenges we were facing of how we have that conversation, and it's more of a family approach conversation where you in situations like that to make sure we get that message quite clear in a very, very simple way, of the main information that people actually need to know, rather than overloading people with a lot of information. So there is a lot of local stuff happening across Sheffield within sort of the VCF sectors that is really, really pushing that information. And I guess it's how we sort of form platforms like this to make sure we can share that information and people can ask questions without feeling that they can't ask a question, to be able to sort of get that message as wide as we can, and there is a lot of support through networks to sort of really target some of those conversations, I guess.
Before we close up, Sheffield Foyer had their hand raised. Do you still want to add something, Sheffield Foyer?
Still on mute.
Hi.
Yeah.
Can you hear me?
Yeah.
Yeah.
Okay. So as well as having lots of young people with us, we've got one of the highest percentage rates of the BAME community in a hostel. We have at least 55% of our residents are people of colour, which is unusual. And they don't have their families necessarily with them to talk through any of the issues. They just have each other and looking after themselves. And one of the biggest things that's coming out from our Jamaican community here is that, and this is really worrying, because if you believe this, it would be very frightening. They think that ethnic cleansing is going to be happening. And so I think that's a massive deal for them. They also think that they're going to be microchipped, which is another reason. But I think if you think you're in a program of ethnic cleansing, you would be very frightened, especially if you've not got your family.
We had a COVID confidence Zoom a couple of weeks ago that touched on some of the wider myths. I think it is just about there's a couple of quite neat responses that can bust those myths. So I'll make sure that some good information is sent over to you, because you usually after with the right sort of comeback, it very quickly unravels those kind of myths. So I'll make sure that gets across to you. Maxine?
I just wanted to say something about some of those myths, really, because I think that the people who are the most disenfranchised, the people who suffer racism, people who are the poorest, are the people who are most likely to be subjected to some of these myths that go round, really. And actually they're, you know, I mean, have some sympathy with what some of those people have to say, because certainly amongst the, in America, some of the vaccinations were used against Black people in the past. However, I think the truth is that the vaccination this time is going to everybody. So it can't specifically be targeting one community or another. It's being used on everybody, and therefore, I mean, 7,000 people in this primary care network have been vaccinated. That's how, and we all seem to be fine. None of us seem to be having any problems. So I'm fairly sure, I'm fairly confident that really that myth is a myth really that's being used. And actually it's a sad thing really, because in many ways, the people, precisely the people who are less likely to take the vaccination are the people who are most likely to die or be seriously ill as a result of the COVID. And therefore, I think, you know, we need to try and really urge our brothers and sisters in the Asian community and Black community to take the vaccine, because they have a much better chance of survival, and also not to pass it on to their families as well. So it's quite important that we all do this, because we want to make sure that people survive, and this is our best chance really, I think. So yeah, I just wanted to say that really, because I think it is important that we use the forums that we've got. It's not just about us, is it? It's about getting everybody else to understand why they need to have it. And I think there's a lot of people who we are really trying to get to are not at these meetings. Probably they're not digitally included. They can't get onto Zoom. And therefore, you know, we really need to try and cascade the word out and find ways that we can get to those people who are the most disenfranchised, really.
Khadija, we've just got enough time for you to input.
Hold on.
You're muted.
Yeah, hello. I'm from Islam community. I just wanted to ask if we want to make arrangement for our community to be vaccinated from the mosque. Are we supposed to link with Shipshape or with Maxine Bola, or we need to communicate with the NHS? As we have realized, is our community, they are not getting the vaccination. Even the care worker, they've refused to get the vaccination because of the misinformation they are getting from the media.
You can get in touch with either Khatija. We do have a local meeting, which I think someone from Iraq is attending. I think it's on the 18th, so you can bring it up there. But you can drop me or Maxine a call, and we could look at how we might be able to support that.
I think that's probably it, Tanya. We was finishing at 2:30, was it?
Just to sort of, yeah, we were, Tom. Just to sort of round up, if there's any sort of other questions or thoughts people have, you know, you can drop us an email. I realise not everyone, we probably haven't got everyone's email address, so we are going to be sharing the link of today's session, and any information that has come up in the conversation we would share. So if we don't have your emails, please put it in the chat before you leave, just to make sure we can get the information out to you. And I just want to thank everyone, thank our speakers and everyone else for sort of really giving up their time to help support this session. And I think one of the other important things was, you know, it's about how we get this message out to those that are not on social media. So please use what you've learned from today's session, and if there's anything else you need support with, drop us an email, and we will see where we can support. But the other aim was to try to see how you can then go back and share the information with your contacts and your clients and people that you connect with who aren't connected but would really benefit from some of that support. Yes, and I think that's it. Unless is there anything else from Maxine, Gasan?
Just in conclusion, thank you very much. I really appreciate this. I think this is a fantastic forum. Brilliant idea. I don't know whether it's happening across citywide, but let's be proud that if for your information in general, just a few comments. Sheffield has been mentioned in the House of Lords as being one of the cities that is really driving forward with the vaccination program. Our network has delivered, I could safely say, the most amount of vaccinations in a short period of time. In just over a month, we've done 7,000 vaccines, considered to be the most efficient system, smooth flowing, very up to date. We have a fantastic team, and the team we're talking about is not just clinicians, it's the volunteers, it's clinicians, volunteers, it's the staff that come in from the city council, help with the management, traffic, etc. I can't say enough. And with the Heeley Trust, with Maxine and the link work, Maxine, Matthew Reeve and Annie Jackson and their group of fantastic volunteers, it's been brilliant. Most times for a system to work, you need good crowd control and crowd reassurance, and that's what the volunteers do. And it's an excellent system. So we know how to do it now. It was a lot of hard work leading up to this. We know how to do it and do it well. And so now we are in a position where we can extend the services to how we would to catch those groups of people that need more encouraging and coming on board.
Thank you, Gasan. And yes, these sessions are happening across the city. So a lot of the VCF providers and groups have sort of jumped on board and are doing it in very sort of different platforms and really targeting towards communities that they need to sort of be targeting, which is a good thing, and it's good to see everyone sort of coming together to try to make this happen. Great, I think that's it. If there's no other questions, we would call it a day. I guess, Tom, if you could make sure we've got all the information from the chat, that'd be great.
Yeah, I've saved the chat. We've recorded the Zoom, so we'll be putting that out and sending it out. All of the emails that we do have, we'll send some information, and we'll try and follow up on what people have mentioned about linking some of the GPs with the mosques and that kind of stuff, and what we said to Sheffield Foyer about assisting getting some sessions there. So thanks everybody for your input.
Cheers.
Thank you.
Thank you.
Bye.
Thank you. Thanks, everyone.
Thank you.
Bye.